Welcome to the Berkshire Kidney Unit. This film is all about your journey on haemodialysis and what you can expect when you first need to start dialysis treatment. You will see lots of people throughout this film who will all be taking care of you. Hello, my name is Alison Swain and I'm the Renal Vascular Access Sister for the Renal Department.
Hello everyone, my name is Kanigate Napier known, but I'm known to everybody as Kani, and I'm the practice educator for the Renal Department.
Hello, my name is Jon Burik. I'm the unit manager in HMP and Benyon Dialysis unit.
Hello, my name is Diana Murdoch and I'm a renal social worker in the Royal Berkshire Hospital.
Hello, my name is Rizwana Wiles. I'm the renal hemodialysis lead nurse for Royal Berkshire Hospital. I cover Benyon, Huntley and Palmer, and Bourne, Bracknell and Windsor Dialysis unit.
I've been on dialysis now 2.5 years. When I first started, I didn't really know what to expect, but it was all explained to me. I've been, so far, enjoyed every moment. I started on the line and then move on to the fistula, which I find is a much comfortable thing to have. I come on the transport and go back by transport. Extremely good service, can't complain. The nurses I come in contact with are extremely good. I have a lot of praise for them, including the 2 doctors that I see from time to time, which explain everything to me as we go. At the end of dilating, I can still move around. I find it not strenuous. I find it pretty comfortable. I don't have any issues with it. I'm full of water beans.
We want you to know that you are not alone in this journey. So first of all, we know that this is going to be an anxious time for you, whether you have known about your kidney problems for a while or whether it has all happened recently. Hopefully this video will be reassuring to you. So what is haemodialysis? Haemodialysis literally means blood filtering. Haemodialysis does the job that the kidneys would normally do by removing waste products and excess water from the blood. This is done by pumping your blood through a special filter called a dialyzer or artificial kidney, and then returning the cleansed blood to your body. Everybody is an individual, and so each dialysis treatment is prescribed specifically for you. Dialysis treatment lasts for between 3 and 5 hours at a time and happens 3 times a week. This might be on a Monday, Wednesday, Friday or a Tuesday, Thursday, Saturday. You will tend to meet the same people each time you come for treatment, so it becomes quite a social event. Most patients dialyse on a reclining chair and pass the time by watching television, reading, doing crosswords or puzzles, chatting to other patients and staff, or just having a nap. What you can expect on haemodialysis. Your first dialysis session will be for 2 hours and the second session will be for 3 hours. After that, you will most likely have 4 hours at each session. This length of time may be increased depending on your blood test results. You will be given an appointment guide time, which is the time you can expect to start your dialysis. It may end up being slightly different to that time, but it's usually within 30 minutes of the guide time. We will show you where to hang up your outdoor clothes and where you can weigh yourself. We provide tea and coffee, cooled water or squash, and biscuits. Sometimes it's a good idea to bring a snack or sandwich with you as well. If you would like to, we are very happy for you to participate in self-care, or what we call shared care, as it is good for you to retain as much independence as possible. You can help with anything from taking your own blood pressure all the way through to putting yourself on the machine. So how do we get to your bloodstream? So before you can start dialysis, we need to have access to your bloodstream. This can be done in one of 2 ways. Ideally, you'll start haemodialysis treatment via an arteriovenous fistula, or AVF. A fistula is where a connection is made between the artery and the vein, either at the level of the wrist or at the elbow. This is a very minor operation and it is carried out under local anaesthetic. As a result of this operation, the veins in your arm will grow bigger and stronger because the artery causes more blood to flow through the vein. Dialysis is then carried out through 2 needles which can be placed in the vein. You can learn to put these in yourself or the dialysis staff can do this for you. If you need to start dialysis urgently, then access is usually made via a large catheter that is put into one of the large veins in the neck. This line, known as a tunnel catheter, is inserted as a day case in the X-ray department at the hospital. No overnight stay is usually necessary. Looking after your access. It's really important that you take very good care of either your line or your fistula, as this is your lifeline to dialysis treatment. With a fistula, there should be a buzz or a thrill in your arm that you can feel. You will be shown how to check this for yourself, but please make sure to check this every day and get to know the sound really, really well. Let your dialysis unit know if anything changes. Keeping your fistula clean is of the utmost importance, and equally your line if you have one. You will need to maintain really good hygiene to prevent infection. Wash your arm with soap and water regularly and be careful not to pick at any scabs from your needle sites. Keep the site covered with a dressing. Medical support during treatment. You will be seen in a clinic whilst you are on dialysis, saving you appointment times on other days. A doctor will generally see you every 3 months. For any non-dialysis related conditions, you should still visit your GP. The environment on each dialysis unit allows curtains to be drawn, so examinations can take place and the spacing between each machine allows protection of confidentiality. If you feel you would rather talk to a doctor away from the unit, then the clinical room is available after dialysis for further discussions, or you can request to be dialysed in a side room on a clinic day if it is available. We will also arrange for an interpreter if needed. If you are unwell on a dialysis day, you do still need to come for your treatment. Missing a session is not going to make you feel any better and might actually make you feel worse. Eating and drinking whilst on dialysis.
So my name's Kevin Jesty. I'm one of the renal dietitians. One of the functions of the kidneys is to remove excess fluid from the body. In chronic kidney disease, the kidney's ability to produce urine eventually starts to fail. Dialysis can also remove fluid from the body, but it is not as efficient as healthy kidneys. As you only have dialysis 2 or 3 times a week, the amount of fluid that you take in through drinks and through food may need to be limited in order to avoid becoming overloaded with fluid. When you first start on dialysis, one of the renal dietitians will come to see you to help you decide on how much to drink. We can also help you decide which foods to eat and which foods to have less of, according to your own personal preferences and circumstances. Nobody likes to be told what to eat, so we try to take into account your own opinions and your quality of life as much as anything. Along with the doctors, we keep an eye on your blood tests and weight changes, amongst other things, on a regular basis. Based on these and what you tell us, we can advise on any changes to your diet, your medical treatment, including dialysis. Many people do their own research, particularly online, to find out what they should be eating and drinking. Often that can be confusing, but we see ourselves as providers of reliable information. We prefer not to be too prescriptive. We prefer to work with patients to find out what dietary approach works for them. The biggest nutritional issue with dialysis tends to be muscle loss over time, which can have an impact on things like mobility, infection risk, and hospitalization. So the most important thing for us is to help people stay well nourished.
Social support. A social worker for renal is here to support you in any way that you would normally expect. This might be looking at supporting you with applying for any benefits or with housing issues. If you are working, we will support you as much as we can by getting you on dialysis promptly and trying to allocate you the shift that best suits your schedule. We can always contact your place of work if you need any help or support with your employer because of being on dialysis. You will have heard a lot from us in this video, but finally, we want to emphasise the importance and the value we place on listening to you. Your quality of life is really important to you and to us. We assess this on a regular basis using the short questionnaire on your health and well-being. This holistic approach helps us to understand your problems and how we may be able to help you. All decisions about you and your treatment will be shared decisions made with you and with your family. It's important to remember that although you will need dialysis going forward regularly, you need to remain in charge of your treatment and not let it control your life. Being independent and taking responsibility for your own health and care is really important for you. Being involved with your care in some way is really vital. So do talk to the nursing team about what you can do to help yourself. Remember, we are always here to help you. Thank you for watching this video. We hope it has been helpful for you.